All right. Good morning, everyone. Thank you so much for joining us for our Telemedicine Town Hall, the State of Telemedicine in Massachusetts. My name is Jamie Gaines. I'm the Manager of State Government Relations at Boston Children's, and I will be moderating your panel today. So first, thank you so much for joining. We know this is an important event at an important time in our state's history with telemedicine, and we want to thank you for both registering to attend and submitting your questions in advance. Just to give you a little update on what will be going on today, we're going to start with presentations from Shannon Moore, who's our Director of State Government Relations, followed by Heather Meyer, who is our Director of Virtual Care at our Innovation, Digital, and Health Accelerator. We'll then go into our question and answer session, which will be moderated online by Allie Doyle, the intern in the Office of Government Relations. And just as a quick flag, all out-of-state licensing and reimbursement questions are outside the scope of this Q&A, but we will be providing you with contact information for the Office of Government Relations and IDHA so that you can follow up on those really specific questions. Calls to action are going to be in the link in the chat box. If you have any technical issues, just feel free to let us know in the chat box and Allie will help you out as necessary. With that, I'm going to turn it over to Shannon. I'm going to ask panelists to turn their cameras off and we can go ahead and get started on today's important topic.
Great, thank you, Jamie. I'll give a quick overview of myself. My name is Shannon Moore. I am the Director of State Government Relations at Boston Children's Hospital. I came on board in March. Prior to this position, I worked for the state for 13 years. I served in the state legislature for 11 of those years, and then most recently I was at the Massachusetts Department of Public Health working as their legislative director. So I'm very excited to bring all of that state expertise to this role at Children's. So I wanted to start by doing a brief review of all the events that brought us to today, and to quickly stand up all of the telehealth services that were being provided by virtual visits. On March 10th, in response to the growing concerns about COVID-19, the governor declared a state of emergency. This declaration gives the governor broad powers to quickly respond to emergencies through the redistribution of state resources and allows him to take other emergency actions. This is important because this authorized the governor to enact certain temporary laws and regulations without the approval of the state legislature. As many of you know who have advocated for legislation at the State House, the traditional legislative process can be quite lengthy, and this allows the governor to circumvent some of that time. So this announcement was followed by a series of emergency measures in all different sectors of state government. But one of these emergency orders was to allow healthcare providers to utilize telehealth services and also to provide coverage for these services. This was done through a series of Division of Insurance issued provider bulletins, as well as Mass Health issued provider bulletins and guidance. These orders are in effect for the duration of the public health emergency unless they are otherwise rescinded by the governor, and I will talk about why that is important in a minute. There are also a number of federal CMS waivers and guidance that were issued, but I'm sticking to the state actions for the purposes of this presentation. Next slide. So a few months into the state of emergency, in late May, the governor formed a reopening advisory board to work on a comprehensive plan to safely reopen the Massachusetts economy and to ease social restrictions while minimizing the health impacts of COVID-19. The advisory board proposed a phased-in approach for businesses reopening and is providing on its website industry-specific guidance for safe reopening. These phases are based on certain metrics that the state is tracking. They're related to confirmed cases of COVID and hospital capacity, among other metrics. We are currently in phase 2 in yellow of this plan. It is possible that the state could return to an earlier phase if data starts turning downward in the trends. The governor's office has been clear in its communications with BCH and on its website that telehealth must continue to be a part of the state's reopening plan whenever possible. They have committed to keeping these emergency orders in place throughout phase 4. So these special rules and regulations could be in place for quite some time. Next slide. This slide is from the Governor's Reopening Advisory website. I know it's really hard to read, but I just wanted to show you that on his website, there's telehealth referenced all over the place. The governor has committed to maintaining telehealth services as a critical part of the reopening plan. There's an understanding on the state level that the telehealth structures in place should not be revoked without ample advance notice to providers who may be planning appointments months ahead of time at this point. I also just wanted to mention that pediatrics is referenced multiple times in the reopening plan as an area where children in some cases will need to attend in-person appointments due to regular vaccination schedules, and that in-person pediatric appointments will be appropriate for care in certain circumstances. Next slide. So what is next? How do we ensure that telehealth remains an option for care and that providers are reimbursed for these services? Option one would be to ask for action from the governor's office. You could ask the governor and the Division of Insurance and Mass Health to consider regulatory approaches to coverage, platforms, and appropriate services for telemedicine once the order is rescinded. Or option two, which is the more likely option, would be a piece of legislation that the House and Senate would need to vote and agree upon and then send to the governor to sign into law. The advantage of this route would be that codifying these executive orders and the bulletins that both Mass Health and DOI have put into place, putting these bulletins into law would provide long-term stability over any regulations that could easily be changed. Next slide, please. So what would we like the legislature to include in such a bill? Some participants on the call may recall that prior to the state of emergency, there was a bill working its way through the legislature that was filed by Representative Golden and Senator Lewis that was to advance and expand telemedicine services. This bill would have required that all payers, including Mass Health and the GIC, cover telehealth services on par with in-person visits, adopt proxy credentialing to streamline credentialing for telehealth providers, and also would have included a flexible definition for telehealth to include coverage for both interactive services and asynchronous services. Since the emergency policies that are currently in place go far beyond what was originally proposed, there are additional considerations we are asking reps and senators to take a look at when building a new piece of legislation that would address the healthcare landscape that we are in during and post-COVID. The list on this slide is not comprehensive, but I wanted to give you an idea of what we are considering asking the legislature to include, including reimbursement and coverage parity for commercial payers, GIC and Mass Health, for all providers that can provide services through telemedicine. So we also are asking considering a more comprehensive definition of telehealth, including for evaluation, diagnosis, consultation, and prescribing and treatment for all types of care, including medical, oral, mental health, and substance use disorder conditions. Proxy credentialing, which was also in the original legislation, to align with the federal rules to kind of remove some duplicative paperwork and reviews at each site that provider seeks to offer care. We would also maintain the emergency rules barring prior authorizations for medically necessary services. And importantly, any legislation must address the digital divide and disparities in access to technology and translation services, recognizing that there are residents in low-income, urban, diverse communities that either need the option of audio-only telephone, other technology considerations, and how do we address the language challenges for those with limited English proficiency. Next slide, please. There are limitations to what we can do through state law through a piece of legislation. So on the first bullet there, the state insurance laws and regulations do not apply to self-insured plans. The state cannot pass a law requiring these plans to participate due to federal restrictions. And this is a significant portion of the market, so it's just something to be aware of while we're working on this. The second bullet, the state law can only address the rules and regulations for licenses overseen by the state or for Mass Health and certain payers in the state. The third bullet, the government relations team has been getting a lot of questions about potentially joining an interstate licensure compact. Massachusetts does not currently belong to any physician or nursing licensure compact, and the legislative process to make this happen could potentially take a long time. And the last bullet on billing across state lines, while there are emergency CMS rules in place, giving providers flexibility to get Medicare reimbursements, this is a federal rule and not a state rule. So I hope that gives everyone an idea of what's going on in the state level. And we'll do the next slide, please. So today we are asking that you please sign up for our advocacy list. We receive action alerts as the legislature works on a telehealth package. Your voice is an important piece of our advocacy work, and legislators need to hear from you to put a face on the work they're doing at the State House and really understand the real impacts that telehealth is having on patients in their districts. If you would like to share your story or experience with telehealth, please check the box when you are signing up for our advocacy list, and someone from our office will reach out to you with the next steps for sharing specific stories. With that, I am going to turn it over to Heather Myers to discuss how telehealth has been implemented at the hospital during COVID.
Thanks so much, Shannon. So today I'm just going to briefly update everybody on, Jamie can hit the next slide, on really where we're at with our current status, some of the initiatives that we are planning for the future, and then really our next step priorities. Next slide. So current status is we are, since COVID hit over the last couple of months, we are completing approximately 8,000 virtual visits a month. This is up from, or a week, this is up from approximately 100 virtual visits we were doing a week. And you can see from the graph on the right side of the screen, prior to COVID, we were completing about 500 visits a month. And over the last couple of months, on average, we're completing about 30,000 visits each month. We have hit a major milestone as of yesterday. Since our program inception in 2017, we have completed over 100,000 virtual visits, and cannot thank everyone who is represented either on this call and across the entire organization for helping us to get to this major milestone. We have trained, and there are over 1,300 clinicians who are actually using and offering virtual visits to their patients. And amidst the really rapid scale up, our patient and provider satisfaction scores have remained fairly constant, even though we have rolled out a couple of different platforms and options, such as using Zoom and also a phone workflow that includes some of the billing components and models in those workflows. We've worked very closely with contracting and also compliance, financial services, Office of General Counsel, on many of the changes that Shannon has discussed that have really allowed us to expand at the scale that we have, and all of the many changes that are happening on the payer front. So all that information is listed on our website, which has helped us to really educate the departments appropriately on how patients can receive the virtual visits. Next slide. One of the most important things to us too is what are some of the feedback that we're hearing from patients and departments, and some of these stories have been just truly rewarding to hear. I think one story in particular is what we're hearing from the Alcohol, Substance, and Abuse program, where for the first time, they were actually able to have a 100% attendance rate whenever they were extending their group therapy session virtually, which is just a major milestone even for, I think, all of the patients that are represented in the group, that clinic in particular. And we've heard many of these success stories from many other departments. And that whenever patients are receiving care in their own home, that there has been a significant decrease in the anxieties that they might incur if they're coming into the clinic. So it's just so rewarding. This actually keeps us going on a daily basis for hearing this. So thank you so much for everyone who's providing this great feedback. Next slide. And this just highlights some of the great patient experience and perspectives that we've heard collectively across the organization. And numerous times we've heard that having access to this type of care has really made a difference in the work-life family balance. And it has been a more convenient way, yet a still very effective way to receive the care that they would normally be receiving if they came in person. Next slide. We have had the opportunity since COVID to meet one-on-one with almost every single department across the organization. And we have heard pretty consistent themes from everyone. One, that it was really easy to actually transition care to be completed virtually, and every clinic literally did this in a matter of days. Yet there still are some gaps in some of the capabilities, whether that would be from technology side or some of the operational improvements that we can still improve and make some of the enhancements to the system. So it's been great to actually receive that so we can focus some of our priorities on what will make the biggest difference to ensure that virtual remains a constant modality that everyone is able to offer to their patients. We also, next slide, sorry. We were also able to, next slide. We were also able to survey the clinics on really how will virtual remain within your clinics whenever we are going through the reopening that Shannon was discussing. And our survey results back from our clinics really show that over the next 12 months, most clinics on average do think that most of the visits, 50 to 60%, will continue to be completed virtually. And then next slide, Jamie. And then looking into the future at 2022 and beyond, that still virtual will remain pretty constant on average across all of the clinics at around 30 to 40%. So this is very different depending on really the specialty that is represented. I think for behavioral health, it could be a higher percentage would be virtual versus maybe other clinics like dentistry that would have a lower percentage. So, but it's great to see collectively, and one constant theme that we've heard is that virtual will continue to be an offering for patients, regardless of what time period it would be. And the next slide. And then we've also had the opportunity to survey both patient families as well as administrators and clinicians on, for a virtual visit platform, what are some of the most important features and functionalities that everyone would need to have to ensure that it was a feasible, appropriate option that we could still continue to extend. And it's been very constant across whether it be clinicians, administrators, or patient families, on having a high reliable video connection, having high quality audio and video, having easy scheduling capabilities, so not having the multiple step scheduling process, having mobile capability, and last but not least is having multiple participants, whether that would be multiple providers or multiple patient family guests join, are really some of the most important features that everyone would need in a continuing virtual visit platform. And then next slide. So really our priorities that we are focusing on next is with our current platforms is really making the ongoing and needed improvements to those current platforms. So in the near term, we are working on what will be some supplemental combination options that we can use. For example, how could we plug in Zoom as part of SBR to make that a more complete package where there would be less administrative burden, yet more reliability on the video component. So there'll be more information coming on that in the upcoming days and weeks. We're also working on the longer term next gen platform, as we call it, that will have all of the most important features and functionalities that we received back in the survey, as well as from our one-on-one department interviews, to ensure that we are having that as our long-term platform for everyone to use. And then third, we are continuing to look on a daily basis and make improvements for all of the different components of the virtual visit program, whether that would be from an operational, a user guide, the finance and rev cycle pieces, and also ensuring that we're having the proper support needed for all the departments. So we're actively and aggressively working on all of those pieces. And really given the last piece here is really given the light of what this presentation entails is advocacy on both the legislative and on the payer front continues to be one of our biggest priorities, because we really need this to ensure that it becomes a seamless offer in the future for all of our patient families. And the next slide. So just a couple ways for everyone to stay informed and involved on some of our work that we're doing. This week we actually did host, and we'll have another session tomorrow. It's for using Zoom, so you'll hear some of the key enhancements, improvements that we made, as well as some of the best practices that we've learned from the different clinics on how they're incorporating Zoom into their clinic. And next week, we'll be actually kicking off and launching a learning collaborative series. And this will really focus on having clinics, so physicians or administrators, be able to provide best practices, learnings, and it will be hosted by our team, but we really would love for all of the panelists. You'll see our first one represented here next Tuesday. It will really be a time for those panelists to be able to share their learnings on how they're incorporating virtual visits into their session. So that one will, our kickoff session will occur next Tuesday from 4:30 to 5:30. And as always, our latest and greatest information as our source of truth always remains constant on our Web 2 page that you can find all of our virtual visit information. I think that's everything, and I will hand back over to Jamie.
Thanks so much, Heather. And thank you, Heather and Shannon, for those presentations, because now we have lots of times to answer all of the questions. So we received over 35 questions through our online panel, and we're going to start with those questions to kick us off. Just as a reminder, the questions will be kept to the subject matter that we're discussing today, and we will not be covering any legal or regulatory questions. So to kick us off, do you believe that payment parity for telehealth will continue after the state of emergency ends?
I think it could continue, and I think there are a lot of stakeholders in the healthcare industry that see the value in all of these telehealth services, but these services need to be paid for. I think, Heather had a lot of great stories in her presentation. It's really important. I can go up to the State House and tell the legislators that this is important for our patients, but it's really, more important for them to hear from the folks on this call about the success stories that we've seen. So I appreciate everybody signing up for our advocacy and sharing their stories with us so that we can advocate for why payment parity is so critical to continue with these services post-COVID.
Thanks, Shannon. And Allie is going to be putting the sign up to that newsletter in the chat box. So if folks are curious about what that process looks like, definitely check out the chat box. So I think the next question is for Heather. In the future, what will be the preferred platform?
Yeah, so we're working on a couple of options in the near term. We are looking at a few combinations that would enable Zoom into either SBR or Epic. So we're working on those very closely with ISD. So we're in the middle of exploring and testing those. There should be actually more information that we'll be releasing this week on what those options are, as well as in the upcoming weeks as we know more. As our longer term, we are working on really what would be the scaled platform that we would have across the enterprise. So our team is rapidly looking at third-party vendors and pursuing those and discussing those. So there are very exciting information coming in just hopefully a matter of hours out to everyone.
Thanks, Heather. I think this question can be for both of you because you'll have different takes on it, but we got a lot of questions around the importance of behavioral health. So access to behavioral health continues to be an ongoing issue, particularly in pediatric populations. How do you see telehealth assisting with that?
I'll start, and then Heather, you can add on. I think Heather's team has a lot of good data about, compliance with appointments for behavioral health and other types of appointments. We've heard anecdotally, some stories about patients preferring such appointments, especially in particular with certain children with co-occurring diagnosis, for example, that they might be more comfortable having some of these appointments from home. Again, we're looking for stories if anyone has success integrating behavioral health into their care plans for patients. We'd love to hear your story so we can show all the different ways that telehealth can benefit patients through different areas of the hospital and how behavioral health is being integrated in addition to other types of care. I welcome any additional conversation with anyone who wants to discuss this after the webinar about how we can ensure that behavioral health is a part of this package and not overlooked.
Yeah, and from our end, we've always had an amazing partnership with Department of Psychiatry on using virtual visits as part of their ambulatory care for all outpatient visits. And it's been amazing to see the patient uptake as well on that end. And I'll say really what has been the front runner on getting Department of Psychiatry to be one of the highest users, and prior to COVID hitting, they did really contain about 50% of our virtual visit volume. And it was really because of having the reimbursement already. So most of the payers were already recognizing that there was a shortage, that there was an access issue with behavioral health, and they were reimbursing for those behavioral health codes or part of the behavioral health plans. So that helped us to get to that point, but to still continue to get that, we do, as Shannon mentioned, is still continuing to need to hear those stories, to see some of the outcomes that it is providing, and everything, which it's been amazing to see how that same uptake has actually occurred throughout the organization with the other departments too.
Can you address how potential legislation will address the digital divide and the cultural competency when it comes to the needs of patients?
Sure. As I briefly touched upon, as we are discussing how legislation could ensure that patients are not left out of care, either due to lack of technology, lack of internet access, or just language barriers. We are asking that the legislation maintain parity for audio-only appointments, for example, to address the digital divide for folks that might not have video access at this time. We're also asking for the definition of telehealth to remain pretty broad because, technology is ever changing. There might be creative solutions that might come out that if we are too explicit in the definition of telehealth by listing out which types of technology are available, we might miss out on a future opportunity to bridge this divide. We're also trying to figure out how we can address, linguistic challenges. Every hospital and every provider is going to be serving different populations, and the legislation is going to need to be flexible in how hospitals understand these challenges or address these challenges. So I don't know if Heather has anything to add about that.
Yeah, from our end, it's been really a core priority for us to actually have interpreters as part of our virtual visits, knowing that that's actually a core part of how Boston Children's offers care. But even whenever we surveyed peers on how are they incorporating interpreters and accounting for translation needs, is most of them actually kind of made this stance of, well, for virtual, we don't do that. And we knew that that wasn't the right answer for us. And so we actively pursued to ensure that we had those options. And even whenever we have done some surveys within our own primary care clinic on what are the different technologies that folks have. And there are patients that do have the needed technology, but there may be either some Wi-Fi issues, or there are either storage requirement issues. So thinking about needing to actually have an application, there might be an older generation phone that they would be using. So it's been really important for us, as we are actually searching for the right technology, that we would have technology that works on lower bandwidth, that doesn't take as much storage, that wouldn't eat as much data, as well as having interpreters as part of that visit. And I know Sandy's team here at Boston Children's has been really fabulous, as well as working with us on the Zoom workflow that we've rolled out, and also ensuring that we have all of those, whether it's our patient landing page or all the patient instructions, that those are all translated into the different languages that patients need. So we have those in the top 7 needed languages. And we've had that, and I think it's been a great way just to ensure that all patients are being informed properly. And I'll just say one other piece too is that we have made patient videos, because sometimes we've learned that actually reading the instructions is a little bit more of a barrier than actually hearing the instructions. So it's been great. Again, this is why the feedback actually means so much to us, because it actually does help us to reach patients, make the needed improvements, and we can take this back to Shannon's point. We can actually take this back and say, these are why all of these different either technology modalities or why we need this for to serve the broader population.
Thanks. We're going to go to a question that came in from Terry Noseworthy. Will the platform be able to accommodate patient visits with the supervising physician for residents and fellows, where there would need to be 2 providers, 1 resident, fellow, and their attending?
Yeah, so this is definitely a must-have in any platform that will roll out, is that it will account for, I'll say, multi-provider, so both on our provider end, and it could also include maybe an external provider where there would be a collaborator, and then as well as on the patient end too. So we would want multiple guests who could join with the patient, knowing that sometimes there's a caregiver who is away from the patient, or maybe one of the parents are in a different location from the patient child at the time of the visit.
Thanks. Shannon, this question is from you. What makes a compelling telemedicine advocacy story?
Sure. I think, let's see. I think, you know, speaking from somebody who used to work at the State House, a compelling story is kind of a mix of how you actually did your job and how the telemedicine is making your job better or easier for both you and the patient, but also, you know, a little bit of speaking from the heart in there. When people, you know, legislators and their staff can really tell when it's something that you truly care about, or, you know, are really working to make your patients care better. And, you know, I think encompassing, you know, some practicalities, but in addition to some emotion is always good there.
Awesome. Heather, this question is for you. And you may have answered it in your slides, but do you know what percentage in volume you have seen telemedicine visits increase over the last several months?
Yeah, so great question. And our digital health team has an amazing analytics team, and many people get a lot of credit for a lot of the great data that our team sees. But we have actually seen virtual visits scale up. So prior to COVID, we were about 1% of all of our ambulatory volume. Whenever COVID hit, we were slowly ramped up, or I should say quickly ramped up, and we're pretty constant at about 80% of all of the ambulatory volume. That kind of fluctuated anywhere between 75 to 85%. And that was all of the total ambulatory volume. Knowing that the total ambulatory volume actually did decrease, if we looked at our, and still currently look at our current virtual visit volume compared to post or pre-COVID ambulatory volume, we're at about 40 to 50%. So I think we've been fairly constant with the 50%.
Heather, this question is from our live chat box. Will other disciplines like social work and interpreters be able to attend these interdisciplinary meetings?
Yes. So we actually do have an actual live version for doing this. Is we are able to, for the Zoom workflow today, the interpreters can actually be part of that Zoom virtual visit for the patient. So very similar to if anyone's using that. That same workflow will be possible to include other care team providers as part of the visit. So it will not just be a physician or a resident. It could actually be any care team as part of that, also including interpreters.
Thanks. Shannon, I believe this question is for you. Many children and families prefer in-person visits, particularly if their child has special behavioral health needs. Do you plan to advocate for consumer protections that would allow patients and families the option to choose whether they want an in-person or virtual visit?
Thanks. I think that's a great question. I think consumer protection is definitely going to be something that needs to be addressed in the bill. I think a lot of folks think of it as the opposite way. Will people be protected if they choose to have telehealth services? Or maybe that was pre-COVID when we were working on the piece of legislation that was the focus of making sure that if people have people want the option to choose, that they're able to choose and they won't be penalized one way or another. So the shorter answer to your question is yes, that is an important component of the legislation, that consumers must be given the option to choose.
Thanks. Heather, is your data published including patient satisfaction surveys? And if so, where would we be able to find these references?
That is, that's a great question on how we do share that. We are actually, we have in the past always sent out a monthly report to all of the departments that were active virtual visit departments. We are actually creating, again, with that amazing analytics team, we are actually creating dashboards so that departments can go in and actually access their own data. So we do actually try to provide that to all of the departments, but I can actually take the question back to our analytics team on if there is another source that is more readily available to access that.
Great, thanks. Are there current plans to upgrade camera features and or intraoral camera options for dental virtual visit appointments?
Oh, I'm assuming that question's for me. So we are doing another collaboration with ISD that to ensure that for any readiness that clinics would need for their virtual visits, that they can actually reach out to the help desk directly to ensure that their clinics are set up and ready to go for virtual visits. This would include needing any of the software or hardware. The one question about having any specialized camera is kind of what the question sounds like. Happy to answer any of those questions offline, as it may not be part of our current setup, but we are also exploring certain connected devices that would actually have an enhanced experience for the virtual visit. So this was one of the takeaways that we also received from the clinic interview. So please, if anyone who's on this call submitted that, please feel free to reach out to me directly and we can provide more information.
Great. This question is for Shannon. Can you talk a little bit about how the regulatory process would look for telemedicine after the emergency order ends?
Sure. I think going back to kind of early in my presentation, should the state of emergency end, I know that the Division of Insurance and Mass Health are taking a look at what would be able to be continued through the regulatory process. It would be kind of, it's kind of unclear to what extent they would be able to voluntarily continue such services through their own regulations, which is why we're kind of pushing hard to do this through a legislative process. I could, if there's any follow-up questions on that or need additional clarification needed, you can certainly reach out to the GR team and we can get some clarification on that.
Great. And I also see a question in the live chat if the survey is done in English only. Currently, it is only done in English. We are hoping to be able to take our advocacy survey into other languages. And if folks have resources of how we can help do that, please let us know. We want to make sure that we're able to access as many folks as possible who want to participate. One final question from our pre-submitted questions, and I would encourage folks to continue to submit questions into the live chat box or the Q&A. For Shannon and Heather, if you could keep one thing permanent about the state of telemedicine right now, what would it be and why?
Heather, do you want to start?
Mine would be having payment parity for all services.
I agree with that statement. I also agree. I would say just ensuring that the various platforms and technologies are supported moving forward so people have access to their care.
And actually just one final question. How can we continue to ensure equitable access to telemedicine?
I think you know, through advocacy with our government relations office, again, you know, we're going to be pushing really hard to incorporate your stories and have people contact their legislators to express why this is so important moving forward. Is probably the best way we can do it right now. With the State House being closed, we're probably going to be doing a lot of our advocacy over email, but you know, we'll certainly be looking for creative ways to communicate these stories moving forward.
And one more from the chat box. One of you mentioned that providers have been surprised by what they were able to accomplish via telemedicine. Heather, would you be able to share some examples of this?
I think it's actually been really amazing. We've had a couple of amazing advocates already, folks who have done this. I'll call out one name in particular. I've tried not to call out any names, but Dr. David Hunter has always been such a great champion for us across virtual visits. He's the chief of ophthalmology, and most people have seen this classic picture that we have is that he had a puppet that he would actually help to do some of the eye exams for his patients. And you know, it's always really interesting for a clinician to see how another clinician actually does and conducts the virtual visit. And with that, it's been amazing to see how creative folks have been on actually saying, well, yep, I could actually watch the patient walk. I would have them set their camera, or I would have them actually hold both hands up, or I would have them take me into their refrigerator to let me see what's there, how they're measuring things. So it's been really amazing to hear how people have been creative in actually completing the same level of visits, or they might have be able to take the height or the weight of patients, and if they're doing a weekly check-in, then having that scale kind of become a constant for them to see if there's been any changes. So it's been really amazing to hear, especially as the clinicians get in the room. That's why I would really encourage everyone to join the learning collaboratives, because that's a great way for really administrators or clinicians to be able to learn best practices from each other.
It seems that our call for last question spurred a fury of questions, so we're going to go for about 4 more minutes. Shannon, this one is for you. Hoping you have a crystal ball, do you have a best guess of when the emergency order might end?
you know, working with the legislature, there's always an opportunity for me to take out my crystal ball. And in this case, the governor has expressed that the emergency will continue until there is either an effective treatment for COVID or there is a vaccine for COVID. So I think the potential for this state of emergency to continue for quite some time is very realistic. You know, I would say through the fall, and depending on whether cases increase again, you know, if we have to go back a phase, if things get worse, you know, that might extend it even longer. So I would say through the fall into early next year at the very least. You know, I don't think we're looking at any treatment or vaccine, you know, anytime soon. So that's the best answer I can give at this time.
Thanks, Shannon. It would be really helpful if you could share that crystal ball with us and the rest of the BCH team. I'm sure there's quite a few departments that would like to see it. Heather, this question I believe is for you. Are you collaborating with any national associations such as the American Occupational Therapy Association, Mass OT, or the Physical Therapies Association and then there was no follow-up, but I'm going to create the follow-up to developing best practices. And then for Shannon, are there any of these groups involved in a larger scale advocacy?
So our group is very active with the American Telemedicine Association, which does have various special interest groups, many of the specialties that are represented. And that organization or association has actually put forth some telemedicine guidelines, whether that would be for pediatrics, ophthalmology, etc. And then there are usually what we have found, and usually I'm not personally a part of any of these, but with any of our prior, I'll say high utilizers of telemedicine or virtual visits, as part of their individual associations, either more recently or maybe due to COVID, they have actually produced some guidelines. So my recommendation would be to go back to those individual associations to see if they are if they either have anything or if they're developing those, if you could be part of that work group so you can share that back directly with us. And also, if you reach out to me, we also do have an American Telemedicine Association account. So I'll be happy to get anybody in touch to be able to create that institutional account as well.
On my end, in terms of advocacy, I know I've heard from some OT and PT folks here at the hospital. In terms of national organizations, I haven't personally been in touch with them. It doesn't mean that they haven't submitted any input either to, you know, the hospital association or other stakeholders that are working on this issue. If there's, you know, folks that want, you know, us to have contact with those such organizations from an advocacy level, I would welcome a conversation.
And just last question for Shannon, can you give a quick overview of the TMed Coalition and some of the advocacy that's happening there? Because I think folks would find that their associations and interest groups are already around that table.
Sure. You know, we've been doing a lot of work with the TMed Coalition. It is, I guess, for lack of a better word, being spearheaded by the Mass Hospital Association and many of its members. They have been doing a lot of work, and a lot of the talking points about what I was reviewing with what we would be interested in looking at for a piece of legislation have actually come out of the work that we're doing with that group. And we've been having, you know, quite a number of conversations about what is happening at other organizations and what needs to be in a piece of legislation to continue work not only at our hospital, but at other organizations. Heather has also been sitting in on those calls, so I don't know if she has anything she wants to add about that organization.
No, they've done a fabulous job representing, and it's actually great that Massachusetts does have one coalition body who is really advocating for the same, I think, priorities, as well as including all of our data so that it aligns. I think it's great that we have many voices that are represented there, all wanting the same thing.
Great. So first, I just want to thank Heather and Shannon for their time today. We really appreciate getting your questions answered. We were not able to answer all questions, but Allie will be sending up a follow-up email that will include all of the links that we talked about here today. It will include a recording of the presentation and then as well as some answers to the questions we were not able to get to. In terms of action steps, I'd like to encourage everyone to sign up for our telehealth advocacy emails. It's going to be so critical to make sure that we are able to rapidly respond to any changing landscapes. Once you sign up, you'll get a link to be able to share your stories and experiences. Currently, that is only in English, but hopefully we'll be able to diversify that survey soon. If you're not already a member of the Children's Advocacy Network, please reach out to us at the below email address and we'll make sure to put you on the list and connect you to our newsletter and other events like these. And if you have questions for Heather and her team, you can reach out to the virtual visit team at the email address below. Again, thank you to Heather and Shannon. We really appreciate your time today. Thank you for everyone that joined us. This is our largest scale event, and we so appreciate you being able to join us. If you have suggestions of what you'd like to see us do in the future, please email the CAN address below. Again, thank you so much. Have a wonderful rest of your day, and we'll be in touch soon. Bye, everyone.
Thank you.
Thank you.